Hello and welcome to the Covered Behavioral Health Services Guide training. Before we get started, Mercy Care would like to remind you that we are not able to direct providers on how to bill. And we can't give direct coding guidance. We encourage all providers to ensure that you have a certified coder on staff, as well as experienced billers. The guidance is developed by Access and delivered by Mercy Care. Mercy Care does have a mechanism for you to submit questions, but please keep in mind that specific coding scenario questions cannot be answered, as those scenarios would require direct billing guidance which the plan cannot provide. A QR code is available at the end of this presentation. It will direct you to important information, such as the complete PowerPoint presentation, links to resources, and the provider attestation. Providers must adhere and train their staff on billing requirements found in the Access Covered Behavioral Health Services Guide. The guide includes the Behavioral Health Service Matrix, which is also called the B2 Matrix. It also includes the Same-Day Disallow Table. Also review the American Medical Association CPT codes and HCPCS guidelines. Contractual obligations and service definitions can be found in the Access AMPM policies and procedures. Mercy Care also has provider manuals, including a claims manual, located on the Mercy Care website. The Access Covered Behavioral Health Service Guide is meant to complement, not replace, the information in Access policies, operations and billing guides, or provider manuals. Providers must ensure their billing practices comply with all applicable federal, state, and local laws, regulations, standards, and executive order. This guide does not list all available codes. Please review the Access Medical Coding resource page, fee-for-service schedules on the Access website, and consult AMA CPT and HCPCS codes before billing. We strongly recommend hiring a certified coder. Billing practices may be audited by Access and the Tribal Regional Behavioral Health Authority. Providers must comply with any additional billing requirements established by a managed care organization if the provider is contracted. Not all service issues can be fixed with a hard edit, some may require other corrections. For UB04 codes, refer to the UB04 Manual, NDC Standards, CPT, and HCPCS guidelines. Providers must register with Access to render services. Only providers who deliver services to members may bill and receive payment. Registration with Access is required for a provider to render services and submit claims. AMPM Policy 610 notes Access provider qualifications and information regarding registering with Access. A list of provider types and applicable enrollment requirements are listed in the Provider Enrollment Screening Glossary. Let us now explore the staffing designations.
As an independently licensed behavioral health professional and independent biller, I am responsible for directing and overseeing clinical care for members I serve, as well as services provided by behavioral health technicians and paraprofessionals. I must register with Access and cannot bill under my ID for services performed by others, except for applied behavior analysis services.
As a behavioral health technician, I am allowed to bill for services under the Licensed Facilities NPI, utilizing HCPCS codes. My name should appear as the rendering provider in Box 19 of the CMS 1500 claim form, UB04 or 837.
As a behavioral health paraprofessional, I can bill under the Licensed Facilities NPI, utilizing HCPCS codes. I can provide services under a licensed healthcare institution or agency and under the supervision of a behavioral health professional.
I am a peer and recovery support specialist who has life experience. I have completed training and passed a competency exam through an Access recognized peer and recovery support employment program. I have met all the requirements outlined in the AMPM 963, and I am credentialed to perform at a minimum as a BHPP.
I am a credentialed family support partner who completed the training through the Access Office of Individuals and Family Affairs. I meet all criteria outlined in AMPM 964. I function at a minimum as a BHPP and help support members and their families or caregivers. When billing for services, use the CG modifier.
Providers contracted with Mercy Care must adhere to all additional billing requirements set by Mercy Care. Providers must use CPT and HCPCS codes listed in the Access Behavioral Health Services matrix. To bill Access-approved codes, providers must be registered with Access. Some codes require modifiers, which if used, should be supported by clinical documentation. Telehealth is recognized as an effective method for delivering certain behavioral health services, and providers must follow Access telehealth requirements, including proper use of place of service codes and modifiers. More information can be found in AMPM 310I. Behavioral health services that can be billed as telehealth are found in the Access telehealth code set. Telehealth shall be provided in accordance with best practices outlined in the Assertive Community Treatment Evidence-Based Practices Kit. Place of service should clearly specify where services are rendered and match the documentation. Place of service code combinations can be found in the Access Behavioral Health Services/B2 matrix. Diagnosis codes are also essential for claims, especially if the diagnosis code is needed to meet medical necessity standards. It is also important to note that social determinants of health C codes are informational only, and that Diagnostic and Statistical Manual of Mental Disorder codes cannot be used for billing. Documentation must justify diagnoses in the comprehensive assessment. Now let's turn our area of focus on the core billing limitations found in the Access Covered Behavioral Health Service Guide. There are several core billing limitations that must be followed when billing services. There may be other billing limitations which are noted within the code's applicable section of the guide. Today our Mercy Care team will review some of the general core billing guidance.
Access shall cover procedures, products, and services when they are medically necessary. Services must be individualized and match the member's symptoms or diagnosis without exceeding their needs. The behavioral health needs of the member must be documented in the service plan. The procedure, product, or service must be safe, cost-effective, and not primarily for the convenience of the member, caretaker, or provider.
Providers may bill only for time spent providing the actual service. All billed services must comply with applicable coding, documentation, scope of practice, and policy requirements. Non-face-to-face activities such as note-taking are not separately billable unless specified, as these activities are included in the rate.
Provider signatures must be electronic or legible written form in blue or black ink. The signature must be followed by an approved credential and indicate the exact date and time of the signature. Access expects all documentation to be generated at the time of service or shortly thereafter. Delayed entries within a reasonable time frame, 24 to 48 hours, are acceptable for purposes of clarification, error correction, addition of information not initially available, and if certain circumstances prevented the generation of the note at the time of service.
For all services billed with HCPCS codes, with the exception of Case Management and Care Coordination codes T1016 and H0023, the provider may not bill any time associated with leaving voice messages, sending emails, or contact with the enrolled person, family, or other involved parties. Excluding inpatient evaluation and management codes, providers should bill all time spent directly providing the actual service.
The begin and end time must be noted on all progress notes and all documentation of services rendered by the provider. The beginning and end time must be accurate to the time each member participated in the service. Templated or pre-printed times based on schedules are not permitted. Clinical oversight supervision may not be separately billed. And finally, if a member or family member misses their appointment, the provider may not bill for this time.
Let's take a deeper dive into time intervals, or what we like to call the 8-minute rule. Providers should not bill services less than 8 minutes in duration. For example, when looking at this chart, a provider would bill a single 15-minute unit for treatment greater than or equal to 8 minutes through and including 22 minutes. If the duration of a single modality or procedure in a day is greater than or equal to 23 minutes through and including 37 minutes, then 2 units should be billed. For treatment times exceeding 2 hours, the same billing pattern applies. Services represented by 15-minute timed codes must be billed based on actual time spent, at least 15 minutes equals 1 unit, 30 minutes equals 2 units, and so on. It is not appropriate to count all minutes of treatment in a day toward the units for one code if other services were performed for more than 15 minutes. When more than one service represented by a 15-minute time code is performed in a single day, the total number of minutes of service determines the number of time units billed. Providers are expected to maintain an average of 15 minutes of direct patient contact for each billed unit. Consistent billing of units with less than 15 minutes of contact may be subject to review. If more than one 15-minute timed CPT code is billed during a single calendar day, then the total number of timed units that can be billed is constrained by the total treatment minutes for that day. Providers must also adhere to all time-specific coding requirements as outlined in the AMA CPT coding guidelines. Moving on, let us explore more billing limitations found in the Access Covered Behavioral Health Services Guide. Certain outpatient behavioral health services may be billed on the same day as inpatient admit or discharge when permitted. These include mobile crisis with billing code H2011, case management and/or care coordination services which are used to support intake and discharge. Providers cannot bill for other services while transporting a member. Some CPT and HCPCS codes are restricted to independently licensed practitioners with specialized behavioral health training and licensure. Please review the Access Behavioral Health Services matrix on the Medical Coding Resources page to identify providers who can bill CPT codes. As a reminder, all coding scope of practice and documentation requirements must be met. Access registered providers who are independently licensed behavioral health professionals shall utilize all available CPT codes when billing for services. Here are a few examples when a behavioral health professional would not utilize a CPT code to bill for services, but instead use HCPCS codes. Alcohol and/or drug services or multisystemic therapy for juveniles. Services provided by a licensed independent addiction counselor. And case management services that do not have an applicable CPT code. Travel billing limitations are noted in Access AMPM Policy 310B. Additional supporting clinical documentation may be required when billing for certain services. Providers are prohibited from voiding and replacing claims with new codes or billing in smaller units to avoid submission of clinical documentation. Only one per diem behavioral health service may be billed on a single day for a member. A provider shall not split services among more than one claim to avoid unbundling edits. The Group Payment ID, Provider Type 01, may only be used for billing. The Group Payment ID/Provider Type 01 cannot be used as a servicing provider ID. Claims for services rendered by a non-independent billers, such associate-level behavioral health professional, behavioral health technician, or behavioral health paraprofessional, shall be submitted using the licensed behavioral health facility NPI and the rendering provider listed in Box 19. To bill access for behavioral health services, a behavioral health facility shall be licensed through the Arizona Department of Health Services and shall designate one or more behavioral health professionals to direct and oversee all behavioral health treatment services. Independent billers are required to be registered with Access before they can deliver services. Once registered, claims should be billed under their ID and not through the facility ID. Any therapeutic service provided in a group is limited to no more than 15 members per group unless otherwise specified by Access and/or within the Covered Behavioral Health Services Guide. Some CPT codes may have different descriptions for therapeutic service, and those guidelines must be followed. For group sessions that include family members, group size shall be calculated based on the number of members attending the group. Providers may request group limit exceptions from contractors, and access to support specialty programs and rural community needs. In order to bill services to a managed care organization, the provider must be credentialed and contracted with the managed care organization. Our final topic to review today are services that are not covered by Medicaid. Non-Title 19 and 21 are non-Medicaid dollars. Funds may come from grants, state appropriations, or other resources. Non-Medicaid covered services can only be paid for with non-Title 19 and 21 funds. Non-title services are covered based on eligibility, medical necessity, priority population, and other restrictions based on funding source. Services provided through non-title funding are limited by availability of funds and are not an entitlement benefit. A provider must be contracted with and receive payment through Tribal Regional Behavioral Health Authority, or an Access Complete Care contractor with Regional Behavioral Health Agreement or another entity with a non-title contractual relationship with Access, in order to use these funds. Non-title eligible populations are enrolled with an acute care contractor with Regional Behavioral Health Authority or Tribal Regional Behavioral Health Authority and other entities that have a direct non-title funded contractual relationship with Access. Mental Health Block Grant, MHBG, claims must be submitted with a UB modifier. Substance Use Block Grant, SUBG, claims must be submitted with a U7 modifier. Services which may be covered by non-title funds through acute care contractors with Regional Behavioral Health Authority or Tribal Behavioral Health Authority. Thank you for watching the Access Covered Behavioral Health Services Guide training. Providers must review the remainder of the training by reviewing the complete presentation starting on slide 26 using the provided link or QR code. Be sure to review the specific definitions, codes, criteria, and service-specific billing limitations independently, and don't forget to complete the attestation after finishing both Part 1 and Part 2.